Cuyahoga County Committee of the Whole meeting for Monday, March 18th is now called to order. Andrea, would you please call the roll?
Good afternoon, everyone. It is now 1:04 p.m. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Mr. Sweeney. Mr. Sweeney is absent. Mr. Byrne.
Here.
Mr. Gallagher. Here. Mr. Schran. Ms. Conwell. Ms. Conwell is absent at the moment. Ms. Turner is absent at the moment. Ms. Stevens is absent at the moment. Ms. Simon is absent at the moment. Mr. Kelly.
Here.
Mr. Miller.
Present.
Council President Jones.
Here.
We need one more for a quorum.
More, 1, 2, 3.
I think we had 6.
We have 6. I know I went to public school, but that's still.
Okay, 6.
I am so
Nope,
sorry.
I didn't see anybody else
I
up
know.
here. Yeah, thank you.
Yeah, we have 6. Yep. And I got it right, thank you. I know you did. That's right, all right.
Where's everybody else? Oh, thank you. That's what I was missing. Thank you. You have a quorum.
Mm-hmm.
Council President?
Bear with me one moment. All right. Again, has anyone signed in for public comment?
No public comment has been received.
All right, okay. Well, at this time, I am going to pass the gavel to Councilman Miller so that he might chair our committee for our budget process and discussion. All right.
Thank you, Mr. President. And we now go to items referred to committee. 2024-0414.
Resolution 2024-0414, authorizing purchase order number 2400-4227 with Tech Communications, Inc. in the amount not to exceed $594,499.40 for a joint cooperative purchase for the renewal of various Cisco Voices licenses and support services for the period October 31st, 2024 through November 4th, 2025.
Thank you very much. And for the record, Councilwoman Turner is now in attendance. Please proceed.
Good afternoon, council members. My name is Matt Ruby on behalf of the Department of IT. So this particular item is requesting your approval for all the licensing and support that the department uses to operate our phone systems countywide, as well as our call centers that operate here for our service desk that, again, caters to the majority of the county, as well as call centers for the Board of Revision and for juvenile court. This item is being put through as a joint cooperative based on federal GSA pricing. So it was worked out, the prices were procured competitively. However, it's worth noting that the way we did this procurement internally, we did it as an informal RFB in an attempt to discover, it's been 5 years since we had to procure these particular licenses, so things have changed, understandably, in 5 years. So we wanted to go out to some of the partners that we have in the private sector to find out what has changed and how to best adapt to our needs. So Tech Communications was the winning bid for that, but again, it is based off of federal pricing.
Thank you very much. And for the record, Ms. Conwell is now in attendance. Any questions by my colleagues? Oh, thank you. Any questions? So how does the pricing compare to what we're currently paying?
I can give you specific numbers after the fact, but I can generally say the prices have increased. It is also worth noting for this purchase that there are a couple of additional licenses that are new to what we procured in the past, so that also brought up the prices as well, because we included some licenses tied to increased usage for security for our internal security team.
And did the prices increase moderately or substantially?
Honestly, I don't off the top of my head, but I can get you that answer.
And how many participated in the informal bid process?
There was four
Okay.
vendors.
Fine. Any other questions? So the contract date, we're past that date, so we need to move this as quickly as possible. So I'm going to ask for a motion to refer this item for passage on second reading suspension.
So,
Is there a second? It's been moved and seconded to favorably refer Resolution 2024-0414 for second reading suspension. Any further discussion? Hearing none. All those in favor say aye. Aye. Any opposed say nay. Ayes have it, and the resolution is so recommended. Resolution 2024-0415.
Resolution 2024-0415, authorizing a purchase order with Logicalis, Inc. in the amount not to exceed $545,587.44 for the purchase of various NetApp hardware, software-related accessories, and support services.
Matt Ruby for the Department of IT once again. So the core of this purchase is hardware. The hardware we're purchasing is for data storage at both of our two data centers, one here in Cleveland and one down in Columbus. Here in Cleveland, we are replacing outdated equipment as well as expanding our capacity. Down in Columbus, the purchase is strictly for expansion. That expansion is based on additional security initiatives, sort of like the previous item, because we're monitoring more, because we're getting more and more sophisticated with our security as we move along. This item, is worth noting, is being put through as an exemption, but again, it is based on GSA federal pricing. The reason why it is showing as an exemption is because there was a couple of small dollar items, cords, ancillary things that were not technically on the GSA schedule.
Any questions by my colleagues? So this is also a routine item, and we want to move forward as quickly as possible. May I have a motion for second reading suspension? Is there a second? Been moved and seconded. Any further discussion? Hearing none, all those in favor of favorably referring 2024-0415 for second reading suspension, say aye. Aye. Any opposed, say no. Ayes have it, and it is so recommended.
Thank you.
Resolution 2024-0416, authorizing an amendment to a contract with Alliant Insurance Services, Inc. for insurance brokerage and risk management services for the period January 1st, 2023 through December 31st, 2024, to extend the time period to December 31st, 2025, and for additional funds in the amount not to exceed $2,374,000.
Good afternoon. I'm Awatif Assad on behalf of the Law Department. Joining me this afternoon is Shane Story, Vice President of Alliant Insurance Services Public Entity Group. Alliant has been a great partner for the county. It represents over 10,000 public entities, including the state of Ohio. This amendment will extend the county's contract with Alliant for insurance brokerage services through the end of 2025 and will authorize the expenditure of funds up to $2,374,000 to cover the cost of these services. We have presented to you a schedule of the insurance policies and associated premiums paid in 2024. We anticipate annual premium increases, as is typical in this industry, and therefore have budgeted the $2,374,000 for this contract amendment.
Thank you very much. Could you tell us what the main coverages are that are provided, and also what the cost is that we pay to Alliance for managing this process?
So the sheet, the policy sheet that I provided you details or lists the policies. The bulk of our cost is associated with the property insurance policies for the county, the convention center. We have cyber liability. We have aviation, general liability, and the fine arts. We also insure our fine arts. Also, we insure our vehicles in excess of that have a value of excess of $100,000. And with respect to the broker's fee, for the first time, the county capped the commission, the brokerage fee. I mean, it is a fixed fee, and we are paying now currently $150,000 a year to Alliant.
So, if I understand this correctly, we're basically buying two things. One is that we're paying Alliant a fixed fee to go out and negotiate on the market and find us the best rates and coverages for the kinds of insurance that we need. And the second part is to pay for the insurance premiums themselves. Is that a correct summary?
That is a correct summary, yes.
Any other questions by my colleagues, Councilman Kelly?
Thank you, Mr. Chairman. What is the crime coverage?
Sure.
Yeah, so basically that covers for any unforeseen or unanticipated incidents that might occur, that whereas like an employee theft type situation or a computer funds transfer type of scenario, that's essentially what it would cover in those situations, where there's loss to assets, loss of funds due to these particular acts.
Okay,
And
thank you.
for example, let me give you an example. There was a stolen check in the mail 2 years ago, and it was forged. And we were able to recoup. It was in the amount of $575,000. We were able to recoup that through the crime policy.
Okay, appreciate it. Thank you. Thank you.
Any other questions? Ms. Conwell?
Sir, if you could state your name for the record before the council member asks her question, and speak directly into the microphone, please.
Yes, my name is Shane Story with Alliant Insurance Services.
Thank you. And you can move directly into the microphone and kind of push it up just a little bit. Then we can hear you better. Thank you.
Through the chair, so you mentioned that an example. How many examples or how many cases such as that have we had in terms of the crime coverage? Is it a ongoing basis or at least 6? How many accounts do we have?
This occurred, I believe, 2-3 years ago. I've held this position for 5 years. That's the only claim that we experienced, or loss that we experienced.
And it went through with no hitch? They didn't give you, any extra paperwork or anything like that to do?
I mean, there is paperwork, and you have to prove the claim, the loss, and through our advocacy efforts and Alliant, we were able to recoup the, really without any issue.
Thank you.
Anything else? Okay, so this contract expires at the end of the year, and we want to allow some time for processing. So the administration has requested a second reading suspension. Do I have a motion?
So moved.
Is there a second?
Second.
Okay, it's been moved and seconded to favorably refer Resolution 2024-0416 to the full council for second reading suspension. Any further discussion? Hearing none, all those in favor say aye. Aye. Any opposed, say nay. It is so recommended. Thank you very much.
Thank you.
Thank you.
Item number 5, items referred to committee and discussion, Resolution 2024-0407.
Resolution 2024-0407, adopting the 2024-2025 biennial operating budget and capital improvements program annual update for 2025.
Thank you very much, and I would like to call Director Parfiowitz back to continue the overview presentation. And before he begins, I'll just say that we finished the last section on page 2 of the 4-page spreadsheet that's been passed out again to everybody, which gives an overview department by department of the proposed changes. And I'd like to ask if anybody has any questions regarding that spreadsheet before we continue on to the next section, which is going to focus on authorized strength and vacancy credits. Any questions? Okay, so if people think of anything, we'll have an open session at the end of the spreadsheet where anything that comes up can be brought forward. Director.
Good afternoon, council members. Walter Parfiowitz from the Office of Budget Management. Thank you, Councilman Miller, for the intro. Exactly where I was going to start with, pages 1 and pages 2. We've covered already any questions, so I'll move right into into page 3. So page 3 summarizes authorized strength by department, compares it to the 2025 adopted budget. So currently authorized strength impacts, only the county executive agency, so you'll only see changes in the top section. So it's a computation of 4,653 FTEs at pay 19. You could work right across the columns. 186 FTEs for the positions that are in the process of being filled. And then 122 identified vacant positions. Now, when I say identified, it's the agreement between the department and the administration that the position is vacant and should be recorded on our books. So total authorized strength is a computation that includes all of those. So it's 4,962, which is 309 FTEs, more than what was included in the 2025 adopted budget for the county executive departments. You'll notice that down below the boards and commissions and the elected officials, I'm sorry, I should have said that the other way, elected officials and boards and commissions, none of those numbers changed. They just carry across as what was approved in the adopted budget. Questions about this schedule?
So, to my colleagues, I would point out that prior to this, there could be an opinion about authorized strength in 3 different places. It could be in the HR department, it could be in the Office of Management and Budget, and it could be in the department itself. And normally they were pretty close, but there could be little variances and differences of assumption. And part of what the administration is trying to do in this tweaking of the budget process is to have an agreed upon authorized strength. What are the positions that are approved? And as the director stated, it includes the current positions, the positions that are being in the process of being filled, and also the positions that are vacant currently, but that the administration and the department agree ought to be filled. So, anybody have any questions about this presentation? Okay, continue.
Okay, so page 4, I think for those that still have questions, I think page 4, it provides some definitions at the beginning, but then it has an example. We use the clerk of courts as an example just to show how things are calculated. So page 4 in that upper left-hand corner, authorized strength is the agreed upon FTE level by the administration and department, and it was calculated just as I went over. It's the FTEs that were on pay 19, which is the first pay in September, the positions that are in the hiring process, and also the agreed upon vacancies. Now the vacancy credit, it's the value of positions left open each year. So it assumes not all positions will be filled for the entire year. The credit is calculated by dividing the department's unspent personnel services budget by the total personnel services budget for the department. A percentage is calculated for each of the last 4 years, and then the 4 percentages are then averaged together. The 4-year average is the vacancy credit, and it's applied to total personnel services, so that includes salaries and the benefit categories. For each budget, basically for us, we break it down to the accounting unit level. I guess the best way for you to understand is that would be at the divisional level of each department.
So, Director, to be clear and put it in simple terms, the personnel budget for each department is reduced by the vacancy credit amount to allow for the fact that not all of the positions are filled, and on average, there's a certain number of vacancies.
Councilman Miller, that is correct. It just assumes that the positions will go unfilled each year. So let me go over the box on the right. You'll see it's labeled in blue as the clerk of courts. Authorized strength for the clerk of courts had 88 FTEs on pay 19. You'll see there within the clerk of courts box in the sort of the upper left-hand corner, but more in the middle of the page. So the clerk of court had 88 FTEs on pay 19. 17 positions were in the hiring process, and we've identified, and the court agreed, 0 vacancies. So authorized strength is 105 FTEs. Now the vacancy credit. You'll see just down a little bit further, the clerk of court had a vacancy credit percentages of 14.6 in 2021, 0.7% in 2022, and 2.2% in 2023, and 10% in 2024. So the 4-year average is 7%. That's the credit that's applied. So moving down further, that is the way that the budget actually appears in the county record. So the 2025 budget includes pay 19, equity adjustments that we spoke of at the previous presentation, the personnel actions that are in the hiring process, vacancies, workers' comp. The clerk of courts budget totals $8,657,885 after vacancy credit of $606,052. The clerk of courts budget will total $8,051,833. That's inclusive of the vacancy credit. And I just want to say again that that's the way that the budget appears actually in the county record or in our general ledger system. Questions about authorized strength, vacancy credit, or the process?
Any questions by my colleagues? Ms. Conwell.
So through the chair to Walter, the 606,
Yes.
when you talk about, that's the vacancy credit we gave them, or they already had it left in their budget? Just trying to.
That's typically, Councilwoman Conwell, that's typically the amount that they would underspend. That's the 4-year average of what they would underspend their personnel services budget.
Okay, does that equal up to the 7%?
That does.
Okay, so they still have vacancies that they need to fill. So we wouldn't be adding additional funds into their budget until they utilize that, correct?
That is correct. But at the same time, they're filling positions. Other people will leave and create further vacancies. That's the assumption.
Okay, I know internally, we usually, if there's some additional funds that departments did not use, we put it back to the general fund.
It just, Councilwoman Conwell, just never leaves the general fund. All of these budgets are within the general fund, so that's never an issue.
Okay. So it doesn't, because the clerk of courts is, well, you answered it. Thanks.
You're welcome.
So let's take the clerk of courts, for example. It's important to point out that even though the 7% is not included in the clerk of courts budget, and their budget is $8,051,833, not 8,650,000 plus. The department is still authorized to fill the vacancies that are within their authorized strength, but not budgeted for. And if they're able to fill them, then during the course of the year, they will be able to access additional funds to provide for those positions.
That is correct, Councilman Miller.
Councilman Gallagher.
So in essence, are we eliminating FTEs?
Councilman Gallagher, not at all. I
Not at
think,
all?
no, I think we're adding FTEs. In the past, the last several budget cycles, we set the budget at a certain pay of each year. And that was the budget that was set for the next 2-year period. We're taking a different approach here. We're actually funding FTEs, but taking a vacancy credit to reflect their true run rate, if you will.
Why go back 4 years?
An outside consultant was brought in to actually calculate these percentages for us, and that was the identified best practice by Don Brown.
Is it a best practice to go into because 21 is kind of an outlier because of COVID? Why would we include that? Because I think that would skew the numbers.
The numbers from 21 didn't change all that much in this analysis.
I'm just saying,
Yeah,
it
I
just
understand.
pops out and the numbers pop out. Okay, thanks.
Further questions? Councilman Schron.
One of the comments and commitments that I think that this body did 14 years ago is we said we were going to become a much more efficient and effective government, and that we were going to do more with less, and we were going to use technology to help improve. Do you think we did that?
Councilman Schron, I would say that we've used technology, but I'm not sure we've reduced our
Well, I mean, that-
staffing level.
The technology was the driver to get to.
Understood.
Did we get to the effective reducing of the workforce from when we were, when we came on board in 2010 versus where we are right now? So Mr. Gallagher said you went back 4 years. If we went all the way back to the beginning of this new form of government, do you think that we have actually seen a reduction that, I know we did initially with, when County Executive Fitzgerald was in there, we saw a drop, but then it picked back up and it hasn't gone down since, I don't believe.
Well, Councilman Schron, I have statistics with me that go back to 2015. And these are in aggregate. So 2015, we had 7,824 FTEs. What is 2023's number was 7,131. And what we're proposing here is 7,611. So we're still lower than what at least my numbers show historically going back to 2015.
Wait a minute, I thought you said 7,004, how much, 7,400 in 15?
7,824.
Oh, 800. Okay. And does that, but that only runs us back to 15. It doesn't run us back
Yeah,
to,
I'd have to go back a few
doesn't
more
run us back
years.
to where we started
Yeah.
from.
But I could have a look at that. I'm sure I've got those numbers in a budget book going back.
And I know it sounds like a broken record, but we also invested $35 million to bring efficiency. And you've heard me, and you probably anticipated that would be my next comment. And did that $35 million of the taxpayer money result in commensurate percentage of reduction? And it doesn't appear to be the case.
I could say we're down, I can't quantify the number, to be honest with you.
You can quantify as a percentage, certainly.
Yeah, I suppose, yeah.
And with the population having dropped slightly in the county, like as we saw with the city of Cleveland, they're dropping districts in the city of Cleveland. You would think that there would be commensurate in that same reduction of improving efficiencies with what we've done. Thank you.
So, Director, I would like to see the total FTE numbers for every year, starting with the end of the year 2010, which is before we started, and then for every year thereafter.
I will provide that.
Okay, thank you, Councilman Gallagher.
Yeah, Walter, in essence, isn't this just a roundabout way of doing, like, removing budgetary authority for positions that are within all the departments that will bring down the deficit initially, but as you add throughout the year, that deficit grows?
Councilman Gallagher, I wouldn't say it that way because We met with all the departments, and these are the agreed-upon numbers that the directors and the administration
So
have.
they've agreed
Come to
not to fill
consensus.
those positions?
They agreed to fill the positions that are now on their authorized strength list. Every department got a list of authorized strength. That's everyone who's on at pay 19, plus all the the hiring requests in the process, and also the vacancies that have been identified. Those are going to become their authorized strength list for each department, and the department directors have all agreed with the administration on that.
Okay.
Any, Councilman Byrne?
Just a quick question, Director, how are you today?
I'm good. How are you?
Good.
Councilman?
How often is the authorized strength reviewed per department?
Well, it will be done every quarter, but we'll publish a new number every year.
But I mean, for full-time employees, how often do they review the fluctuation in the numbers, or how often do the numbers, FTEs, fluctuate? Do you do it on a yearly basis, bi-yearly?
I take a look at it each quarter, so you'll notice in every quarterly report, there is an FTE schedule in the report, yes. And then we also do it obviously at budget times, and then the results of operations report that shows the prior year's activity would also reflect it.
I was getting at, if a department needs additional beyond the FTE, when is that discussed?
It could be discussed anytime with the county
They bring
executive.
it to your attention or to the executive's attention?
It comes to us for recommendation, we send it upstairs for the administration to review.
So I would add that the desired policy, as stated by the administration going forward, is that if a department needs positions that are outside of their authorized strength, that should primarily be discussed during the budget process. If they're just filling vacancies that are within their authorized strength, well, they can do that, and they don't need any authority to do that.
Councilman, can I just add that the administration did send a message to all directors to constantly review these numbers and only fill the positions that they find that are necessary. Constantly review, be sure we're only filling positions that we need, not just to fill positions because they're either in the budget or a vacancy at the time.
Councilman Tron.
I just want to make sure I understand. What you just said was they were directed only to fill those that are necessary. But I thought you just answered to Mr. Gallagher that a desire to fill authorized positions.
Councilman Strawn, it's authorized positions, but we're encouraging all directors to only fill what you need. As time goes on and departments do become more efficient, they don't need a position, they shouldn't fill that position.
Okay, but I thought you answered, when Mr. Gallagher brought it up, you said that there was a desire to fill all authorized positions. That's not what you're.
No, not at all. I'm sorry if that's the way it came across.
Okay. So if we were to add in, who's actually making the decision as far as authorized but only necessary? Where does that number come from?
The authorized list comes from an agreement between the administration and the department.
Right, but then somebody is going to then take that number and say, okay, of X number, Y is going to be necessary.
That would be the department director. And if it was higher, then it would have to come back to the administration for approval.
Higher is, yeah, that's a different question. But to fill the entire authorized strength, if I think it's necessary as the director, we're going to accept that. Is that correct?
That's correct.
So in worst-case scenario, if we filled all authorized positions, can you give that number to Mr. Miller in addition? Because that's a different number than the one you have on the piece of paper. If we fill in all authorized positions that somebody determines as the director are necessary. Because the possibility exists that they could fill every one of the authorized positions.
Correct. That's correct.
So if we were to fill all those authorized positions, what does that number look like?
That number for 2025 would be 7,620.
Okay, so that is already what you've given us.
That's what I've.
So there's no more authorized positions than
That's
that.
page 3 of the presentation.
Okay, that's right. All right, thank you.
Anything else? Ms. Conwell.
Yes, through the chair to Walter. So in looking at your department breakdown, the two departments that I see needs an increase, or the biggest numbers would be Job and Family Services as well as the Sheriff's Department, or,
That's correct, Councilwoman Conwell. Job and Family Services is budgeted now for 43 more, and the sheriff is budgeted for 97 more than what they were budgeted when the 2025 budget was adopted by council.
right, and I thought the 43 number for Job and Family Services, I thought we had already previously hired. So this is in addition
This
to
is
the
in addition.
hires?
Yep, this
Okay.
is in addition.
So when we authorize that and they say they fill them, whose responsibility is it to see how effective those hirees are? And I know that's specific with Job and Family Services because it goes to the calls and
Sure,
all that.
that would be the Department of Job and Family Services, be Kevin Gowan.
Okay, so I think that when we had, and I'm assuming that David, Administrator Merriman is included in those conversations when they need it.
Councilman Cowan, you are correct. Before that authorized strength list for all of HHS was developed, it was reviewed with David Merriman.
Okay, so I guess the question would be, do you remember how many it was last time? I think it was 40-some they hired prior to this.
Yeah, I think they were authorized for 40 additional staff, yes.
And they got them.
But I think they had probably the equivalency in vacancies at the time.
Okay. So it's just not, the ones that we hired just were not effective. So I just
I think
want to
they're-
know in going forward, if this is included for the increase, that we actually, that the constituents of this county actually sees a better return, so to speak, on their calls and getting in and things like that, so.
Well, I will say it again, that these are the positions that the department directors and David Merriman agreed to.
All right. Thank you.
You're welcome.
Anything else on this? Okay. Thank you very much, Director.
You're very, very welcome.
Okay, we're going to move on to the first of several departments that we're highlighting that are always generative of questions and involve significant policy questions. And the first one is Metro Health. And I'd like to call Director Alexander and her team forward.
Good afternoon. Good afternoon, Chairman, members of the council. We're really excited to be here with you. I'm Christine Alexander Rager, and I'm the president and CEO of Metro Health. I have Mr. Derek Hollings with me. He's our chief financial officer, and we're excited to share with you some results from 2024 and to talk a little bit about our plans for 2025. If we could have the first slide. I thought it might help to share just a little bit about myself. I was able to meet several of you last week, and that was exciting for me as a new leader in this position. Thank you so much. So for those I haven't had the pleasure of meeting, I've been with Metro Health for 27 years. I came to Metro Health after training originally at Youngstown State for my undergrad and then the Ohio State University for medical school. Did residency training in Philadelphia and then fellowship training in Pittsburgh before coming to Metro Health. And working at Metro Health has been the passion of my lifetime. It has been a dream position, and so I'm very excited to be here with you to share what I think is an important, incredibly strong story about where we stand today. Next slide. So just a few words about the macroeconomics that are impacting all healthcare systems. I know you all know this, but COVID changed everything, and medicine is no exception to that rule. So what you see there are some of the things that not only we are dealing with at Metro Health, but every healthcare institution is dealing with, and those are the macro trends. rising costs, costs of supplies, cost of labor, right? Increasing salary, increasing benefits. Our demands are shifting from the inpatient world, which is how most hospital systems succeeded, were high inpatient costs, to the outpatient world, where we're really trying to drive down the costs and get people to the right level of care, right place, right time. There are also new people entering into the market. You really can't, listen to the news or read something in the media about, Amazon getting into healthcare and so forth. So really, there are lots of forces. And then, of course, just always being mindful around the social determinants of health, because so much of what determines someone's health doesn't happen at the hospital or in the office. It really happens in the community. And if we want to impact health, we have to be mindful of that and how we can leverage our connections in the community to help keep our community healthy. Next slide. So now we're going to turn your attention a little bit to some of our strategic investments in what we believe are the ideas and the programs we've created to take better care of our community. And what you'll see there are everything from dentistry, opening up some new dental offices, to taking our world-renowned rehab therapy into the community, deeper into our community satellites where patients can access it more easily. Our school health program, I'm especially fond of this. I was the chair of family medicine when we created school health. And so now we have school health clinics embedded in our Cleveland Municipal Schools. So not just the mobile unit that comes, but a real live clinic in the school for the children to access. We've opened up, more opportunities for care in the community with our Brooklyn Pharmacy that has opened up. We opened up our psychiatric emergency room this year, which is a huge accomplishment for us. You'll see the midwifery program there. I have additional training in maternal and child health, so this one is really near and dear to my heart, being able to provide better care for moms and the infants. And then you'll see the Vector Lab. So the Vector Lab is cutting-edge technology, and we are the only safety net hospital that has a Vector Lab that allows us to create innovative care for patients, and that our patients can receive that care at Metro Health. Next slide, please. The other piece to be mindful of, I alluded to, inpatient volumes are down across the county. So if you just take a look at this of where we've been and where we are now, and this is also what others across the nation are experiencing, no one has gotten back to pre-pandemic levels of inpatient care. Now, some of that is COVID changed everything. So some of this is an improvement that we're able to leverage outpatient care better, and some of it is just shifts in the market that happened as a result. So just to be mindful that, we've really continued to experience that same shift downward of inpatient, but we've also seen increased demand for our services. So while things are going down on one end, we're seeing an increased need on the other. Next slide, please. And so this gives you a little bit of a feel for some of our healthy growth. I mentioned that we're better serving the community with that opening of the pharmacy at one of our sites, and you'll hear a little more about this when I get to our new outpatient building. 14% increase in prescription refills with our pharmacy. The reason that is so important for us is it is safer care when our patients can get their prescriptions with us. Because if the pharmacist has a question or something seems not quite right, they can look into the record and answer the question themselves. So there's no, we better call the doctor's office and wait for the doctor's office to get the message and call us back, and then we can, right? And now the patient can't get their meds for a day or two. When it's within our system, we can provide better, safer care. So that statistic is really important. And then you see other visit volumes and so forth that are up. I would also call your attention to the fact that our average length of stay has improved. So when patients do come to the hospital, we are able to give them care that is quality care and efficient and get them returned home where they belong much more quickly. Next slide, please. And I mentioned this, our new outpatient health center, we refer to it as the Apex building. And just as a historical note, our Glick Center, which is our new inpatient building, and this building were conceptualized pre-pandemic. So some of the delays in getting this building complete were related to the fact that there were market shifts that happened during COVID. We know we needed more outpatient capability. We want to be able to have access for our patients. This building is able to offer that. So this one, we think you'll see it listed there as a game changer. I truly believe this is a game changer. This was originally meant to be partially administrative space and partially clinical space, and it is now going to be completely dedicated to clinical care. And you see a few of the things listed there. This will also have a 24-hour drive-up pharmacy. So while others in the market are closing their pharmacies, we're expanding our services and doing it in a way that makes access easier for our patients. Next slide. And while I'm sharing some of these ideas with you, I want you to know that these were not just informed by my thoughts or the thoughts of our executive leadership team and our board, but really was driven by our strategic plan. So in 2025, our standing strategic plan is set to sunset. And so we're in the process of our new strategic plan, and we have had tremendous engagement in this strategic plan, over 6,000 stakeholders. We had record numbers of employees who answered our survey and gave their thoughts. We had patients that were interviewed. We had non-patient community members, and we've had many other community members and focus groups. So this has been a pretty in-depth process and gathering up that information, because we want to know, what does the community want from their public hospital? We then can figure out how to best meet those needs. Next slide. I'm now going to turn it over to Mr. Hollings, who's going to share a little bit more about the financials.
For the record, Ms. Simon is now in attendance. Thank you.
Thank you, Dr. Alexander. Good afternoon. My name is Derek Hollings, and I am the Chief Financial Officer at Metro Health System. I am pleased to present the 2025 operating capital budget financials. They incorporate quality, culture, operating efficiencies into a financial plan focused on improving healthcare for Cuyahoga County residents. What you're looking at on the screen, if I might orientate you, is 2023A represents our actual results from that period. 2024 is our projected actuals, and 2025 is the budget that we have before you. And I'd like to zero in on the budget. The $2.2 billion of total operating revenues represent strong growth of $149 million, or 8%. As Dr. Alexander stated earlier, this growth is driven by increased demand for expected hospitalizations, for surgeries, emergency department, and clinic visits. Turning to the expenses, the total expense for 2025 is $2.1 billion as well, and it represents an increase of $130 million, or 7%. This expense increase is primarily due to inflation and investments made in labor needed to improve patient access. I'd like to focus you on the bottom of the page at EBITDA, which is another term for cash flows. And our 2025 EBITDA of 147 million is greater than the 124 and clearly represents a increase in cash flows from operations, from our operating results. The takeaway is return on investments informed by our strategic plan is beginning to materialize. The next slide, please. So I presented a table. Now, this is a pie chart with the same information. And the intent here is to give you a different view of where our revenues come from and where they go. Commercial insurance and Medicaid are the two largest. However, revenues are distributed pretty evenly across several different categories. On the expense side, 57% of our $2.1 billion in revenues go to cover salary, wages, and benefits. I'd like to call your attention to the $164 million depreciation and expense. And what that represents for us is the minimal annual reinvestment amount necessary to keep the facilities and other assets fresh. Next slide, please. The 2025 routine capital budget is $45 million, and it is allocated amongst information technology, facilities, and clinical operations. It does not represent previously approved multi-year capital projects or spending on the campus transformation projects. The 2025 operating and capital budget maintains our cash reserves and complies with debt covenants. I will now return the presentation back to Dr. Alexander.
Thank you. So this slide really gives you a good sense of where the dollars go that we are blessed to have through the Health and Human Services levy. And it depicts the whole of the county and breaks it down by district so that you can see through each district how many patients from your district have been served through the county dollars and what are the dollars of charity care that align to those number of patients. So as you look at this, those are the discrete number of patients served, but doesn't tell you exactly how many times they came in for care. So if you see, for instance, in District 1, 2,316, those 2,000 folks could have come in 3, 4, 5 different times. So these are actual just numbers of patients that have been served. So it is spread out throughout the county. And to let you know that through the Health and Human Services levy of $35 million, we also have matched and exceeded those dollars in terms of charity care, that for the first 6 months of the year, we added an additional $94 million of investment in the care of the patients of our county. And that is really, that is the story of Metro. If you come to us, you will receive care. The patients are first. And every decision, I can assure you, every decision that I will make and every decision that our team will make will be focused on what's in the best interest of the patient and of the community. And I think this is really a lovely depiction of that. Next slide, please. But those are just the numbers, and serving someone isn't the whole story. Serving our patients means that we need to provide quality care and we need to provide an outstanding patient experience. So we don't want our patients to just come in and be treated like a number. We want them treated like a human being and to get the same care in our institution as other institutions. So you will see that we have really put a lot of time and effort into improving our quality, our efficiency, our patient experience. So just to brag for a few moments on how we've been successful in this realm, if you look at our patient safety scores, they are up more than 11% this year. But the true story is that we've been working on this for the last 2 to 3 years, and we improved 30%. This 11 is on top of that 30% improvement. Additionally, there are certain groups that will evaluate the quality of the care that is provided by hospitals. One of those is Leapfrog. So we went from a grade C to a grade B in Leapfrog. So that's certainly good news. Now, I went to medical school. Like, you had to get a lot of A's to get into medical school. So we're not stopping until we get all A's. So we're coming for that A next. In addition to that, there are other scoring systems, Medicare and Medicaid, the CMS scoring system, which is a 5-star system. We've elevated now to 3 stars, and we're not stopping until we get to 5 stars. So that's the North Star. We want to be 5 stars, and we want to be an A, and we will get there, and we're getting there by listening more to the patients, to the community, but also to our caregivers who are on the front lines of providing that care every day, because they know the answers. We just needed to create pathways for them to communicate so we could then adjust ourselves and create programming, operating effectiveness and efficiencies to get that done. So very, very proud of that. So with that, that's our last slide, and we are more than happy to take your questions at this point.
Questions by my colleagues? Councilman Kelly?
Thank you, Mr. Chairman. Nice to see you again.
Same.
So I've talked to some people at the outpatient building who are really concerned about security there.
Mm-hmm.
What are you doing to make them feel more secure?
Through the chair to Councilman Kelly, thank you for that question. Safety and security is, always at the forefront of our minds, and we have Chief Greiner, who's a wonderful partner in those efforts. He recently completed a full assessment of our safety and security at the hospital. I think you may be aware of the screening that we have put in place with the opening of the Glick Center. We have new screening, an Evolve system where patients and employees and visitors have to pass through. We've changed to, check-in procedures for visitors that can only get to certain floors where their family members are admitted. So we've really changed around how we allow folks into the inpatient setting. The outpatient setting, we also have Evolve systems in those settings. I think there's still opportunity to do more. In the 2025 budget, we did budget for additional officers, and I know Chief Greiner has a plan of how he wants to utilize new staff and varying levels of staff so that in areas that, have less security concerns, we can have a certain amount of staff and certain level of training of staff, and those that have higher levels of concerns, we then have the more highly trained staff. So over the next year, we're going to be rolling out some of the plans that he's made, which we did include in our 25 budget.
Thank you.
Other questions? Ms. Simon?
Thank you so much, Mr. Chair. It's good to meet you here. Thank you for the presentation. The question I have starts with the demand versus in-person statistics, and there's that delta there is strange to me. If there's this demand for care, what's going on with this lapse of people coming in? Am I wrong in your presentation? Because you said the demand has gone up, but the market has not returned to pre-pandemic levels of inpatient.
Through the chair to Councilwoman Simon. So really that again relates to the changes that have happened post-COVID, that we're driving more of the healthcare into the outpatient setting. So what was once done in an inpatient setting, we've now relocated that into the outpatient setting. So infusions that used to be done inpatient are now being done outpatient. Procedures that we would bring you into the surgical center, we're now doing in procedure rooms. So it really is a relocating of services into those outpatient settings. And it kind of gets back to that Apex building and how we built that building to be able to accommodate that. The original plans for that building were not to accommodate the sort of procedures, infusions, the vector lab that I mentioned to you that's generating all of this, targeted therapy based on cells and genes and so forth, right? All of those technologies have changed how we practice medicine. And so we're now adapting into taking what was pre-pandemic done in the inpatient setting into the outpatient setting. Am I answering that?
So it was the technology that enabled this shift into kind of?
There's technology and just the relentless push to move things into the outpatient world, which comes from multiple different areas. It's the desire of patients to not be in the hospital. It's, technology getting better. It's us having better techniques that we all have learned to do that we now can do in outpatient settings. We have better tools available to us to do those things safely in outpatient settings. So it's really multifactorial.
So two last questions. One has to do with the dental clinic. Is that only location in one place outside of the main campus?
We have multiple
Dental.
locations. We have multiple
So
dental
all the
locations.
places have dental.
Not all places
But,
have dental, but we do have multiple locations. And, my hope is to keep growing our dental locations because there is demand for services.
I can only imagine. That would be something I'd like more information on to do that. And lastly, your slide on the patients by district on the slide.
Sure.
This is generally just general patients that take advantage of services, or is this because you have charity care? Are these charity care patients, or are they all patients with a charity care component? Because you have charity care with dollars next to each district.
So this is by district, the number of patients that were served in that district that qualified for charity care dollars.
So charity care. Okay. Thank you.
Councilperson Conwell.
Thank you. Through the chair to Dr. Alexandra Ruger. Child psychiatric care for the Cleveland Heights Psychiatric Emergency Department. I know we touched on it briefly in our meeting, but as I stated then, there's a decrease in this county of individuals wanting to help adolescents with their psychiatric care. Can you please share with this council what are the plans for Cleveland Heights Psychiatric Emergency Department?
Absolutely. Through the chair to Councilwoman Conwell. Thank you for the question. So the Behavioral Health Hospital is also near and dear to my heart. And so, again, when we started the building of that hospital was pre-pandemic. And we based it on what we knew about the needs for behavioral health care, psychiatric, as well as psychological health care at that time. And as we opened that building, the patients that came had much higher degrees of violence and behavioral disturbances than what was anticipated. So our original plan for that building was to be able to have dual occupancy rooms, which when we have patients with a higher severity of illness and more of a propensity toward violence, we are not able to have double occupancy because that's not safe. In that same setting and same situation, when you have higher degrees of severity of illness, that then becomes also an unsafe situation to bring adolescents and children. So just to give you that lay of the land of what happened with that building. We now have opened the psychiatric emergency room at Cleveland Heights, and those volumes are growing nicely. We do recognize, however, that the Cleveland Heights location is not perhaps the most ideal for all patients. So we do still serve patients at our main campus emergency room. And with the dollars that we were able to receive through the efforts of Councilwoman Stevens, we do have some refurbishing planned for our emergency department, and that will help with the areas where we have patients that are coming with psychiatric concerns. So between those two settings, we think we will be able to provide the care. And then once we have more stabilization of the units in the behavioral health hospital, we will be able to pivot back towards safely admitting teens and children, as was the original plan. But we needed first to kind of hit the pause button and say, okay, this is what we're seeing. How do we best handle this in a way that is high quality and safe for everyone involved? So we are doing some renovations to the building to meet those needs. We have some new leadership of the Behavioral Health Hospital, so they've done some tremendous work in developing protocols and collaborations and so forth. So that's coming along nicely. And even today, we are interviewing one of our finalist candidates for the chair of psychiatry that will lead this building. So there's a lot of hope for the future, but we really did need to stop and be thoughtful about where we were, because we just need to keep our eyes on what is safe for the patients and all involved.
Well, I just want to share that we really need it like yesterday, because what happens, it's a trickle effect. So when there's parents out there that have children that are experiencing those kind of issues and they're at their limit at that moment and they need a psychiatric care for their children, if they're fed up or can't continue, then we see those kids dropped off at the building. So it is a trickle effect. We need services out there for parents that are, because that's our whole mission, is to keep kids and families together, not to, but we know parents need a break. So if once that psychiatrist comes on board, if you could please give her my contact information, him or her, so we can sit down and talk about these issues, because as I shared in our meeting, everybody's turning their back on the kids. And the kids are our future, no matter if they have behavioral issues, mental health issues, and we need to do all that we can to have the help that they need before they get to be 18.
I couldn't agree with you more. We do have partnerships with other mental health agencies, and we do have opportunities to, get patients admitted when they need to be admitted, so that we haven't turned our back on them, but, really trying to find the right placement. But I do agree that there's a need for more services for adolescents and children, and that definitely is a priority for us as we continue to grow in this, care of the patients.
So, Director, my question is about the jail services contract. And my read on the history is that we've gone from two extremes. 6 or 7 years ago, in the bad old days, we were not providing nearly enough medical care to the inmates, and it created a lot of health problems, and it was a very bad situation. But it now seems that we've gone to the other extreme, where people are getting transported to the hospital if there's even the slightest question whatsoever, and that there's probably things that could be treated at the jail more than at the hospital. And whenever we send someone to the hospital, we have to send a deputy and a corrections officer with them, and it just runs up the cost tremendously. And my question is, to what extent do we have a utilization review system in place so that we can determine that we're transporting people to the hospital when they need to be transported, but we're treating them on site when that's possible and safe, and doing this in the most cost-effective manner. And if we don't have such a review system in place, can we get one?
Mr. Chairman, thank you for your question. I almost feel like you're an audience plant for me because I practice at the jail. And so I can tell you my experience from the time that I started at the jail pre-pandemic until the current time. And what we really tried to focus on initially was decreasing how many of the patients that we transported that needed to be admitted and admitted for overnight stays. So we do track what patients go out, why they go out to the hospital, and what is the outcome. I have a slide that I can send to you that, demonstrates what are the most common reasons why we send folks out. We created units in the jail. There is one unit that is medical. There's another unit that is for pregnant women. And we really put a lot of time and effort into how do we manage those units so that when someone would go out to the emergency room for emergent or urgent care that exceeded what we could do at the jail at the time, instead of them needing to be kept overnight or for a 1 to 2 day stay, we could get them diagnosed, get a treatment plan established, then bring them back to the jail and put them on a medical unit and say, we're going to manage this here. And then once the problem cleared, reassign their bed to a different part of the jail. So that was step one, and we've been pretty successful with that. But still, there are transports that happen. And I can tell you the overwhelming majority of transports happen in the evening and overnight and on the weekends. And the reason for that is because we don't have the physician APP staff there seeing patients continually. So that's another piece of the puzzle that we said, okay, now we probably need to shift our staffing model so that we hire folks that are what we call nocturnists, meaning physicians or nurse practitioners who are there at the jail overnight in the same way that we have overnight at other hospital systems. In that way, we can have someone who is there directly assessing the patient. Being the person on call and getting a phone call about someone having chest pain could be a heart attack, could be acid indigestion. But it's really hard to know the difference when you're on the phone with a nurse who's there with the patient in the moment. And so safety first, you end up asking them to be transported in. If we have the physician or nurse practitioner there overnight, they can come, do the EKG, interpret the EKG, order stat labs, get those sent to the hospital, get those results, know where we stand. So we think this next step is going to really help us decrease the amount of transports that we need to do. We're also looking at how we change the model of care to involve more telehealth appointments. We do some limited telehealth, and I can tell you I do this in my obstetrical practice at the jail, where patients who have high-risk pregnancies, they're able to see the high-risk doctor on the screen. I'm able to communicate with the doctor. We have a conversation around the diagnosis. We develop a plan. I can carry out the plan at the jail. The patient hasn't left the jail. We do this very well with some of our patients who have liver disease, with infectious diseases. We'd like to expand upon that. That will then also decrease how many patients will need to be transported. So we're really looking at how do we leverage the technology? How do we leverage the gains from COVID? COVID wasn't all horrible. It was mostly horrible, but we learned a lot of lessons around telehealth and technology. So I think there's some real opportunity there to utilize what we've learned to provide care that's still safe and effective. We're never going to be able to eliminate transports, I'll be honest with you. Patients, when they come to the jail, they're sick. The jail is like running a 1,000-bed hospital, I'll be honest with you. Every single person that comes in has health issues. They don't come with a little card that has all their meds on them. They don't even know what all their health conditions are. They're seen at a myriad of different institutions, some of whom we can readily access records and some of whom we can't at all. So it really is like trying to put together the pieces of a puzzle, but half the pieces are hidden somewhere else. So that's where you'll see we defer to sending someone in where we can get comprehensive testing that perhaps we can't get at the jail. But we're gaining on it.
Thank you very much for that response, and I will recognize Councilman Gallagher.
Welcome, Doctor.
Thank you.
Well over a year ago, we requested an evening physician for nights, weekends. That has not happened. Our total runs in 22 were 1,200, 23, 1,261, and 24, 1,427. And we're not done yet. So, and our jail population has actually gone down because of the ankle monitors that 500 or 600 of our guests would be in the jail. So we've made the request. Nothing's happened that I know of. Last I heard that they were going to hire someone or they had someone in the pipeline. I don't know. I thought we were here in the county the absolute worst in hiring people quickly. You've unless that's the most impossible job, and it might be an impossible job to find somebody to do that. When can we expect that? And the cost was not even a concern because the savings to the county is easily offset. So, like I said, over a year ago, I know you're new, and I've unfortunately come to always having to tell somebody from Metro, I know you're new, this isn't your problem, but it's an issue. So can you give us a definitive timeline on filling that spot, which I think is going to go a long way in helping both of us perform what was necessary for the people we have in the jail?
Through the chairman to council. So actually, we have signed our first nighttime hospitalist. We call it a hospitalist nighttime physician. So we have signed someone, and I believe they're due to start in early December. In reality, we probably need at least 2, but it is very difficult to sign overnight physicians, let alone overnight physicians in a prison facility. So it is a challenging hire, and finding the right person. We did have some good candidates, but they were not the right fit. And what's worse than not hiring is hiring someone who's not a good fit for or has no experience at all in correctional medicine. The good news around this is that we are training more and more residents in correctional medicine so that they're coming out of residency with skills that certainly I didn't have when I graduated from residency. So we do have our first hires, so stay tuned. There's more good to come on that. The second thing I'd like to share with you is that part of my idea of managing the jail is bringing in our team that runs our federally qualified health center. So federally qualified health centers are intended for folks that have higher need. It's a government affiliated program. The dollars flow from HRSA, and we have several federally qualified health centers that are part of our network at Metro Health. We would like to go the next step and bring the correctional facility into being one of those federally qualified health centers. We call them FQHCs. Our FQHC leadership team have already run this through to make sure that, all of the regulations align, that this is allowable. The reason this is a game changer is because federally qualified health centers qualify as loan repayment sites. The jail doesn't currently, as it stands, qualify as a loan repayment site. But if it comes under the umbrella of the FQHC, it does become the loan repayment site. Most folks who are coming out of residency who are willing to do these overnight jobs because they're used to working overnight, right? So coming out of residency, doing an overnight job, you want to go to a loan repayment site where you can work for 3 to 5 years and have a good chunk of your loans retired. So that will be a game changer for us. And if we are awarded the contract again, that would be the plan to bring it under the FQHC umbrella. That opens up the door to a whole nother pool of candidates that we think we can find easily, those 2 to 3 people that can be that nighttime, presence.
Thank you for that. So we can expect one, we're going to work on others. And as all of us are waiting for the new facility to open, I think that'll be the game changer for us. I'm
Agreed.
pretty convinced of that, and I'm hopeful that that'll be true. And our mission with Metro, and we consider you a partner, and thank God for Dr. Boutros coming on board with us, and I give him all the credit in the world, because initially it was the board and the CEO at Metro that said no and fought us until he came on. So I give him a lot of credit for where we were at. Things started going a little bit south with the previous administration. I don't know if you're aware of that. Not important right now, but we're in contractual open bidding, evidently, and I look forward to Metro putting forward a strong bid to bring all the numbers back to reality. I understand where we got to. I fully understand that wasn't Metro's fault. That was the county's fault. But now it's time to reorganize and readjust that. And I'm hopeful we'll be working with you in the far future. Thank you.
I hope for the same. I really do think that the partnership is key. I think that we can make that correctional facility one that you will be very proud of.
Anything else for Metro? Thank you very much.
Thank you.
Oh, okay. Okay.
Thank you, Mr. Chair. So when we spoke the other day, in the previous administration, I heard of departments that had a hard time getting equipment that they needed. But supposedly an obscene amount of money was spent on the executive suites. So I asked for, at that time, from the other CEO, if I could get a straight answer on that, and I did not get a straight answer on that. So if there's any way that you could get that to me, if that did happen, hopefully the spending will be more realistic and more toward the patient and the staff to be able to do their jobs.
Through the chair to the councilman. So we do have information that we can share with you. What I would really love to clarify around that, and I'm not sure what the exorbitant number was, that you had in mind that was shared with you.
Give it to you?
Sure.
$3 million.
It wasn't that. So I'm a family physician. I can get 13 cents out of every dime because I'm from primary care, right? We are very, very resource limited in primary care, so we get creative in how we serve the patients. So I do hear what you're saying. This particular building, where we did the renovation, was set to come down. And so there weren't upgrades done to that building because the thought was when the Glick Center opened up, we would have space in the Glick Center, and that's where administration would locate. And once we got to the Glick Center and we were located there, we realized that actually the space we occupied was needed for clinical care. And so that's when the prior administration decided, okay, we're going to vacate this space so we can expand clinical services in Glick, and we'll go back to the old space. But unfortunately, that old space needed some renovation that was not cosmetic, but some upgrades to the building and so forth. So the biggest chunk of that, which ended up being in the ballpark of $750,000, went into that to try to, get the building back to being functional. The remaining 200 or so went into the, painting, carpeting, et cetera, so that we could move back into that building. So that, but we can actually get you that information.
Thank you, I appreciate it.
You're welcome. Thank you for the question.
Okay, anything else? Okay, thank you very much.
Thank you. Appreciate your time.
Thank you.
So we're now going to call forward our last presenter for the day, Director Andy Johnson from IT. Thank you.
Good afternoon, Council. First of all, Thank you very much for having me. I'm Andy Johnson, Chief Information Officer for Cuyahoga County. So I did receive a couple of questions from Councilman Gallagher that I will attempt to answer during this presentation. I do have a slide that I added, which should be in your hard copy printouts that you have, but may not have made it onto the overhead. So I think we can all hopefully adjust with that, and we can talk through it on paper. So again, the purpose of my presentation is to walk you through our 2025 budget. This was a budget that was agreed to in 2023, and there have been a few changes that I'd like to highlight. So I do feel sorry for you having so many different presentations. I'm going to try to orient you on what this slide is telling you and what the layout of the slide is so you can have the information that you need. Going across the top in that green area there, we have our account, and the Department of IT is broken up into several different accounts, and those are highlighted going down that column under account, and I'll walk through each one of those here in just a moment. To the right is our 2024 budget, then our 2024 projected spend. That gives you a comparison of what we were budgeted for and what we project that we'll spend in 2024. And then 2025 is the budget that, again, was agreed to in 2023 with a handful of adjustments that we'll walk through. So in brief, I'd like to walk down what the different departments are, because I think it's important to understand that what the Department of IT does for the county of Cuyahoga County. And starting at the top is the administration. That's where we put items of what it takes to run IT. We have certain software, we have certain administrative personnel that are in that account. Application development is what it says. This is the group that develops those custom applications, a lot of websites, a lot of billing type software. That falls under the application development group. Project management. Project management is that group that manages those big projects, those enormous projects that take in many of the different departments of the county, and that's where we record that information. Security and disaster recovery. Goes without saying, right? Cybersecurity is a huge part of our business and something we devote a lot of time to. Engineering services, that's the group that manages all those servers that we have. So we have many, many servers in 2 data centers. We have one up here in the Cleveland area, and we have one down at the Ohio State University in what we call the SOC. A couple new accounts that we've added to give greater visibility and give greater accountability to my team, and that is the end user experience. This is the group that really works with the PCs that most of our staff is given. They also work with the mobile phones as we're driving towards more mobile technology. That group is managing our mobile phones. I'm sorry, I skipped one, enterprise applications, and this may be the one that you mostly want to talk about. So enterprise applications is the group that really manages and oversees those applications that go throughout the county, ERP being one of the greatest examples of that, but there are other applications in there that are either connected to ERP or support ERP. Service management, another new group for us. This is what commonly referred to as the help desk. This is a spot where we believe that automation, things as simple as resetting your password automatically, starting to work with some artificial intelligence to start getting people to be able to answer those questions and those problems they have on their own. So you view that as a very big growth area for us. Network services, how do we connect all our computers together from, the courts to HHS to here to all the many, many buildings that we have. How do we connect those groups? Communication services, those are the phones, right? The phone systems that we have, those call centers that we have throughout the county. This is the group that manages that. And then finally, geographical information systems, those great maps that you see, what's happening where, whether it be something that the medical examiner would like to see in terms of, homicides to maybe where, we're doing investments throughout the community. And we do have another fund, I'll just mention this very quickly, and that is the real estate fund. Certain activities that we take and that we perform are able to be paid for by the real estate assessment fund. I'm going to take a breath there. I know I throw a lot at you. Any questions on the group of the department we call the Department of IT?
So, Director, could you explain those 2 items that have the little red, blue 1 and 2?
Absolutely. Thanks, Chairman. So What those represent is if you compare to what our projection is to 24 and then look at what our budget to 25 is, you see a couple of fairly significant differences. I first want to start off by saying that operationally, we are not asking for any more money than we got in 2023. But what this highlights is, thanks to your votes last year in 2023, we were granted $2 million in capital. That $2 million of capital ended up in our security and disaster recovery account. We are going to transfer that $2 million out of that account into our capital funds account. So I wanted to highlight that that wasn't an increase in $2 million in budget. That was just where that capital that you approved in 2023 ended up. And then finally, number two, and that did get offset there a little bit, you notice that from 2024 projection of $2 million in our communications to 4.23 for budget, we're going to adjust that budget and pull $2 million of that out of communications and move that to the end user experience group. And that again goes with our mobile phone contracts, because as we look at it, mobile phones are really transitioning. They are a communication device, but they're also becoming very integral into our day-to-day lives in terms of end user experience.
So does that mean communication services will be 2.23 million?
Yep.
And end user experience will be 3.14 million?
That's what we're targeting for the budget, yes.
Explain why the administration went up from 1.11 to 1.99. That's a big.
Yeah, so we'll see in the next slides that this will speak to Walter's discussion about the strength, the authorized strength, thank you. The authorized strength versus the vacancy credits. And so there are, our personnel budget did increase, and I'll talk about that on the next slide, but also in that administration, we receive a lot of the, what am I going to say, the chargebacks, the adjustments that are done throughout the county. So the physical security, the physical plant, those types of things fall into the administrative budget for IT. So a lot of that is out of our control.
Okay.
All right.
Any other questions on this slide? Okay, continue.
Okay, terrific, thank you. And so on the adjustment slide, and let me move here. So on our adjustment slide, we did receive an additional $2 million for personnel. Again, nothing increasing in our operational budget, but I'd like to walk through why that $2 million ended up. And certainly I might have Walter as a phone a friend on this one, but if we start, and to orient you, you see that dark blue column which talks about personnel, you see expense, you see adjustments, and then you see FTEs. So in the 2025 adopted budget, which again happened in 2023, we received a budget of $12.86 million. And at that time, that represented 103 FTEs. Now, with the authorized strength, that changes the games a little bit. So our FTEs at that time were truly the FTEs that were there at Pay 19. We generally in IT had about 20 open positions, give or take, throughout the year. And that wasn't always the same 20 positions. That may be a variety of different positions as people come and leave the organization. So I just wanted to call that out, that in 2023, $12.86 million was our budget, 103 FTEs. Fast forward to Pay 19 in 2024. As we looked at our run rate, we noted that we had 8 additional FTEs that we hired from that 20 of open positions. And that 8 FTEs resulted in about $1.03 million of additional run rate. So those are employees that are on staff. We were at 103, we're now at 111 with this. Then we look at this equity adjustment, and that has been discussed before, and that's $470,000 that we add into our budget. And then we took a look at open positions, and that was at that time with that reduction, we're down to 14 open positions. And those 14 open positions represent approximately a $1.82 million in salary and benefits. Continue to work my way down the column, then comes in the vacancy credit. And that vacancy credit of $1.32 million reduces our budget. And that's based on the percentage that was calculated by the external group that looked at our prior 4 to 5 years, and I don't know quite the details, the prior 4 to 5 years of the vacancy, meaning those jobs that we had open. That's where the credit landed, was at 1.32 million. So if you net that out, the 1.03 plus the 0.47 plus the 1.82 minus the 1.23, you end up with an adjustment of an even $2 million. And so that brings our personnel final budget to 14.86 and our authorized strength to 125. Any questions on that? I'll pause there again. I know I throw a lot of numbers and a lot of things at you.
Okay, continue.
All right. And then just that column on the right where it talks about the 2025 expenditure, that 34.01 is our bottom line. That is our budget for 2025. That should reflect on the front, on the page we just walked through. And I think that's where I'd like to kind of drop off on this page. I do want to mention, I know that that efficiency, that you've been talking about economics and efficiency. One of the items that I noted is that when I arrived in August of 21, we had 116 active employees. We had about 20 open positions. That's an approximation because we didn't have great records at that point. So 136, I will call it in today's terms, of authorized strength. Through the I guess, efficiency in our department of changing technology, of combining technologies, we've reduced our authorized strength to 125, representing a 9% reduction. So I we that with you just to hopefully give you comfort that I'm very in tune, our team is very in tune to making sure that our department, that we have the right people, we have active people, we have engaged people that are doing the right thing. All right, then I'd like to talk and share with you a little bit about our 5-year capital plan. And thanks to you, Chairman Miller, you had asked for this a couple years ago, and I think it was the first time in the history of Cuyahoga County that we had a capital plan. And so we presented that 2 years ago. You were gracious enough to give us $2 million in 2024 and then an additional $2 million in 2025. We've updated our capital plan for 5-year capital plan to demonstrate the where we envision capital being spent. And so you can see the $2 million in the 2025 column with the projects. One of the questions that Councilman Gallagher asked me was, what are we investing in ERP going forward? And I know back when you're in the height of the ERP days, we talked a lot about the fact that we were going to have to upgrade ERP. For whatever reason, the powers before me decided to implement an older version. We talked about it back then, that the day was coming where we'd have to upgrade that. We've been, over the course of the year, we've submitted an RFP. We've got the results of those RFPs back, and that happened, I think, last week. So we're just now starting the process of understanding that RFP and what's all encompassed. It's a very large set of documents, and right now we're forming the committees to understand, to score these RFPs. But looking at this, in a ballpark figure, I estimate that it's going to take about $8 million over 3 years. Councilman Miller, I think in conference with you at one point last year, I mentioned $6 million over 3 years. That number, based on the responses we're getting, looks to be more like an $8 million over 3 years figure. So we factored that into our capital plan, and that's the first line that you see on the chart there. Now, again, we're not asking for it this year. We're going to spend 2025 negotiating, understanding the RFP, and getting our ducks in a row so that we can hit 2026 in full stride and start our implementation then. I'll pause.
Through the chair, to the IT director. So the $8 million over the next 3 years to be put into the ERP system, what more does the ERP system need?
So great question. And those three years will be starting in 26. So when we go through the budget talks for 26 and 27, this will be a topic of big discussion. But in general, and we have the next slide, we'll talk about this. We are at what I'll say, a old version of one particular slice of our software, the financial piece of our software. We're on what we call is version 10. Version 10 will be no longer supported by the vendor as of 2030. So once that happens, and that financial takes into account really our finances, like our general ledger, but also our payroll system. And so that payroll pays 7,000 county employees. So in our view, we don't really have much of a choice. We need to go forward with this upgrade to get us onto the current version. And that version would be version 11. Now, there's some good news in that, and Infor has adopted a model where rather than doing these gigantic conversions, these gigantic implementations, they've gone much more to a modern, a modern model of smaller incremental updates. So once we do this last big upgrade, we'll then just incrementally continue to update our software. And if you think about Microsoft back in the day, right? You're working with Microsoft, you'd have to take a floppy disk, you'd put it in, and be this massive upgrade that you'd have to do. But in today's world, they're just incrementally coming into your system. That's the model that we want to get to with Infor.
So, I know that we pay in for an annual maintenance fee. Are we going to be able to get to the point where any upgrades are included in the annual fee and we don't have to pay for them separately?
So, Councilman Miller, that's a great question. I did a poor job of articulating that very well. So our licensing agreement does allow for the consumption of those upgrades. So we pay, it's coming to the end, and I have a slide that we'll talk about that in a moment, but we pay, let's say in today, right now, we're paying $1.7 million a year for that licensing agreement. That allows us to consume these updates. This project that I'm talking about, the $8 million, isn't for the licensing, but it's for the services to convert our old system into the new system, our old version of the system into the new system. So once we do this, my expectation is, unless we have some special or some new technology or some new functionality that we want to do, my expectation is that after we do this, our licensing agreement, which is the software as a service model, that will cover any upgrades. We'll be able to consume those internally, and we'll be able to upgrade internally without going out for outside help.
Okay, thank you. Continue.
Any other questions on the capital plan? Okay. So the next slide is, and I won't spend much time here, but I did allude to this from Councilwoman Conwell's question, is workforce management, which is our time tracking. We actually did the upgrade this year internally as part of our operational expense. So that might be an example, Councilman Miller, that you're talking about of where that's something we can do on our own. This was a large one, but it was small enough that we could handle it. We didn't need to get a ton of help outside. But then under what's highlighted under number 2, and my numbers got off a little bit there, that is the project we're talking about. This is taking the project from version 10 to version 11. Sorry. Oh. And so once we do that, you will see that every column now will be the latest version, will be marked as yes, and upgrade required should all be no. They'll just be really small little upgrades that we'll have as we move on in time.
Councilman Kelly.
Thank you, Mr. Chairman. Andy, how long till there's a version 12?
So that's the great question, and that's for me as an IT guy, kind of the exciting part, right? There won't be a version 12. Now, as soon as I say that, Infor will come and do something that kind of makes me nuts, but because when we go to that V11, now it's not massive upgrades that we're getting. They're very incremental. So my understanding and my hope with Infor is that we just have those smaller incremental ones. So they've got some new whiz-banger thing that they want to get us. that will just come through a smaller incremental. Remember that our version 10 right now it's probably 20 years old technology that we have. When we get to V11, we're going to be on modern technology, and that will, in my opinion, will allow for those quicker, smaller, more dynamic changes that we'll be able to consume. And we'll be able to consume those, to Councilman Miller's point, internally. We won't need to get an integrator or a consulting firm out there.
That's actually very good news. Thank you.
Okay, fantastic. And so the next slide, this, because I know ERP tends to be on folks' mind, and we have a lot of other really great things going on, but I wanted to present on ERP some of the items over the course of this year that have been implemented. Now, I want to be very clear that really with anything in ERP, we may implement a module, but that doesn't mean we're done, right? We may implement a portion of the module, we may implement a module fully, but then change that and work on our processes to improve that module. So it always comes down people, process, technology. If that was said 20, 30 years ago, it still holds today, that we look at what our people are doing, what the process is defined, and then we adapt technology to it. And so as we implement things, we could have implemented something 3 years ago. We continue to revisit that to see, hey, can we get better information? Can we get more information? Or can we do it quicker, faster? And so much of what's on this list is actually new technology or new functionality, I should say, that we didn't have 3, 5 years ago. These are new modules within ERP that allow us to do things in a digital manner. I'll put it at that. And one thing I'll call out, and I wish Marty was here to hear it, is we are starting now to look outside of our agency, right? We're now working with juvenile court to pull them, to have them use our time tracking system. So it'll be a fairly long process, maybe a few months, and that's something that the court is very willing to jump on with us and do, and I appreciate Councilman Sweeney's call out on that to make that arrangement.
So, Director, all these items that are listed as complete, were these all items completed in 2024?
Yes. Some are still in process, but yeah, the ones that are...
Other than the 4 marked in progress?
Yep.
That's a lot of work.
Well, thank you. My team keeps telling me, I keep wanting, a little bit more, but yeah, my team keeps telling me it's a lot of work. And again, Councilman Miller, I do want to stress that when we implement one of these, there's probably more work to do, but we've got the technology, we've got the module in place, but it's something we can continually revisit to see, can we do it better? Can we get more information in? So I may come back next year and we may talk about one of these. Hey, yes, we implement, but we improved it. We did more. We utilized it more.
Other questions for IT?
I do.
Okay.
I do have, now I hope it's in your handouts. I have one more slide that I'd like to just quickly address Councilman Gallagher's questions to me. And I know he's not here, but I don't know, do you have it on your hard copies? Okay. Councilman
This
Gallagher.
is the one that says ERP implementation?
Yes.
Okay, yes, we have it in the printed.
Okay, I'll be very brief in my comments. So Councilman Gallagher asked me, what have we invested into ERP? And I thought, he asked me that this morning, so I think my slide is pretty accurate. I know it's in the public domain, so I put this together rather quickly, but I think we're directionally right here. So as I thought about it, I thought back to June of 22 when I had that final presentation on ERP, and we talked about those numbers, and those numbers remain. We talked about that number being 34.72, included capitalized cost, included all the consulting, included backfill, included customizations, included reporting. So we had a lot in that number, and that I think came in about $1.2 million less than the budget I was handed when I came in. So we felt good about that. I know there's a lot of bad history with it, but we felt pretty good where we ended. So to answer Councilman Gallagher's question, during 2022, as we were doing cleanup of the accounts, cleanup of it, where dust is settling, we're looking at, where making sure our financials were in place, we did discover about $200,000 that was classified as operational expense that really should have been in the capitalized. So our final number went from 34.72 to 34.92. Small issue there, but I wanted to be transparent about that. Now, to give then Councilman Gallagher's direct answer, there's a box in the middle there called direct spend. So that's where the 34.92 ends up. 10.9 that we've paid to date in hosting and licensure. And then we're having about $700,000 more in increased licenses. We're using more licenses than we contemplated when this contract was originally created 10 years ago. So that gives us that $46.52 million of direct spend that I'm hopeful answers Councilman Gallagher's question.
Okay, so that includes both the capital cost and the licensing
Includes
cost.
the capital licenses and then the additional licenses, exactly.
Okay, thank you. Any further questions? Okay. Thank you very much.
All right, thank you very much for your guys' time.
Okay. Is there any miscellaneous business? Hearing none and there being no further business, we stand adjourned and we have 6 minutes before Councilman Schron takes over.